What's up, guys? Melvin from Transplant Network.com. Today, we're going to be talking about Xyonhalth's new topical finasteride formula. As you guys know, I interviewed Dr. Hasson, one of the co-creators of this topical finasteride, last year, and I'm going to be playing that interview for you guys today. But I have a big announcement, so stay tuned to the end. All right? Hasson.
Hey, Melvin, how are you doing?
Thanks for joining me. I know I can speak for myself. I'm extremely excited to hear about the big announcement regarding topical finasteride, and I know the community is very excited as well. And it's a pleasure to have a doctor of your caliber here joining us live. So I just want to start off by saying, my introduction was basically, I for one have had tried finasteride and developed side effects from the oral version. Admittedly, I haven't tried the topical version because I heard that even the topical version was giving people side effects. But I'm excited to have you here. Talk about your topical version and how it differs from the other versions and what we can expect, and really what is the big announcement.
Okay, well, I think we started working on a topical finasteride formulation maybe 6 years ago, and obviously our intent there was to make it a topical solution so that patients who were experiencing side effects would be able to use the treatment, and it seemed just to make sense that if we applied it locally, that the systemic side effects wouldn't be as bad or even there. So initially we just tried a simple formulation in a typical base that compounders use in the pharmacy. And, right off the bat, we got positive results in terms of growth. Some of the people had been experiencing side effects, were actually able to tolerate it, but there was still an amount of people, a fair amount, that experienced side effects on the basic compounded topical finasteride. Mm-hmm. So then, we thought, how can we reduce the absorption, the systemic absorption of the topical, and still allow the finasteride to penetrate into the dermis. And at that time, there was a pharmacologist in Milan, in Italy, who was working on the same thing. And I was visiting Milan, seeing patients, and he knew of me and contacted me, and we got together and compared what we were doing. And over the years, we have tried different formulations, gathered data, safety data, efficacy data, and we never had problems with efficacy. The only thing that we had problems with was eliminating the systemic absorption. And our final iteration of the topical was about 3 years ago. And we found that with this topical, clinically, there were no patients having any of the side effects that we got into before. So fortunately, we had some support from the University of Milan Department of Pharmacology. So they ran in vitro tests for us. And these in vitro tests are called France cell tests. And what you can do is you can use a membrane. In our case, we were able to use ex vivo cadaver skin, so fresh human skin. And you can put it in between two chambers, where one chamber contains the gel that we intend to use. And we're able to see, by measuring the concentration of the active ingredient in the recipient compartment, we can see how much has moved through the skin into the recipient compartment, which would be analogous to going systemic or into the vasculature. And we actually came up with a formulation where we could get good skin retention of the drug, and the amount absorbed into the recipient chamber turned out to be 1/19 of the concentration that you would have if you'd been taking the Propecia tablet. So we got good skin concentrations, but we got very little flux through the membrane, which meant theoretically that if we were doing it in a living individual, we'd be able to reduce the amount of absorbed finasteride by 95%. So it's not 100% reduction, but 95% reduction was what we thought very good. So we had a really good response from our patients, and then the next stage was to take it into a clinical trial. So we performed pharmacokinetic trials on patients using our topical finasteride, and we found that we had, pretty impressive results.
So, like, just to compare the oral finasteride versus the topical that you guys have, just to keep it in layman terms, what's like the difference of the amount of absorption, systemic absorption?
Okay, so in the monograph studies published by Merck, who make Propecia, the usual serum concentration in a steady state is about 0.95 nanograms per mol, and we were able to get 0.05 nanograms per mol. So it was around about 5% in our human studies as well. And clinically, we found that patients weren't aware of any kind of symptoms with that amount of reduction.
All right, guys. So the big announcement is in late June, early July, Xyonhalth is going to do its grand opening. I know it was supposed to be in April, but it's been postponed until late June, early July. And we're going to do a live stream with Dr. Hasson and Dr. Simon Pimstone, where you can ask them all of the questions, all of the frequently asked questions regarding absorption, systemic absorption, efficacy, any question you can think of, you will be able to ask. Also, they're going to be working with Hair Transplant Network members. We're going to be doing a deal where a couple of members who agree to share the results in their pictures will get a year's supply. So be sure to message me on the Hair Restoration Network for more information regarding that. Lastly, I just want to say there comes a time where hair loss medication can only do so much. Okay, I just want to be honest with you guys. If you're a Norwood 3, Norwood 4, you can't expect to get all of your hair regrown with simply medication. There are times where medication will only do so much, and then you need to get surgery. If you're interested in getting surgery, if you're in that situation, I'm going to give you 3 easy steps. Okay, step number 1, go on the hairtransplantnetwork.com. Link is in the description, and start learning about hair transplant surgery, the pros and cons, how much it costs, and find out whether you want to have one or not. Once you've decided if you want to have a hair transplant, step number 2 is consulting with pre-screened surgeons. We have the link in the description, guys. We do all of the legwork to make sure these doctors are doing consistent quality work. Lastly, if you got questions that aren't answered in the Hair Transplant Network, go on the Hair Restoration Network. If you guys enjoyed the video, please give it a like. And if you enjoy the content that I put on this channel, please subscribe. I like to see the subscriber number go up. And if you have any other questions, leave it in the comment section. All right, till next time.